Hi everyone, Richard Nijelski here for FitLink. As a fitness professional, it's a requirement that you have the ability to teach a client how to correctly perform an exercise, both for their safety and to achieve effective training outcomes. To successfully teach exercises and instruct clients, it's important to know the exercise you're instructing, have a good understanding of communication skills, and be able to modify or know alternative exercises which will suit the client's needs. Every fitness professional should have the ability to correctly perform the exercises. This doesn't mean you need to set world records with the amount of weight you can lift, but it's important that your own technique is flawless. Some strategies to ensure you have the required skill level may include going through the FitLink exercise database and watching each of the videos carefully, getting a friend to go with you to the gym to practice the exercises, practicing both doing the exercises and your teaching technique with a mentor, analysing your own movement by watching yourself in the mirror when you're doing the basic resistant exercises, arranging to come to the FitLink workshops where you'll have an opportunity to practice the exercises, and having a training session with a personal trainer to give you some feedback on your exercise technique. Understanding an exercise and its biomechanics has many benefits. Firstly, it gives you, the fitness professional, an informative description of how to both perform and assist the actual performance of the exercise. And secondly, it allows you to change or modify an exercise without losing the integrity or purpose of that exercise. This is important for variety and in the case that your client can't do a particular exercise for whatever issue, be that an injury or a lack of ability. If possible, you never want to skip a body part because of an issue. Instead, finding an alternative exercise so that it can be trained safely will ensure your client keeps progressing in their fitness goals. When analysing an exercise, it's important to include the type of exercise, the joints and the joint movement, major muscles including the origins and insertion points, and the type of contractions involved. To do this, firstly, identify if the exercise is a compound or isolation exercise. Next, identify each phase of the exercise. Generally, this will be an in and out or an up and down. Identify and include the joints involved in the exercise and identify the type of movements that occur at each of those joints. Be sure to identify the prime moving muscles that control each movement at each of the joints and the origin insertion points of each of the prime moving muscles. And lastly, identify the type of contraction for each phase of the exercise. When teaching a client an exercise, the instructor should firstly explain the exercise that is being undertaken. This should include the name of the exercise, the equipment which will be used, the major muscle groups being used, the relevance or purpose of the exercise, as well as any safety requirements. For your own peace of mind, a risk analysis for any environmental dangers should also be conducted. When demonstrating an exercise, it's important that the client is situated in a position so that they can clearly see the exercise demonstration. The visual demonstration can include some instruction, however, the main focus should be on allowing the client to focus on the correct technique and process of the exercise. The demonstration should include several repetitions as well as a verbal explanation of the exercise. Using logical progression, explain the body position or posture starting from the feet up to the head or vice versa. Explain the movement of the exercise including start and finish positions and any additional information such as breathing, the joints involved in their movement and the type of contractions involved. Try not to overload the client with too much information. Give 4 to 5 main points or teaching cues to the client, as this will be easier for them to recall when they're doing the exercise on their own. As an example, when teaching the bench press, the cues could include lie flat on the bench with your abdominals engaged and feet flat on the floor. Have the bar in line with your eyes. Grip the bar about shoulder width apart. Lower the bar just above the chest and breathe out as you push the bar away. After the demonstration and instruction, it's time for the client to perform the exercise with the fitness professional's guidance. As a helpful reminder, go over the cues again with the client. And during the performance of the exercise, provide the client with feedback, correcting their technique as required. A good method of providing feedback is to provide positive feedback and then outline the technical corrections needed, followed by another positive statement. This is often called the sandwich approach to providing feedback and is an effective way to give the client positive reinforcement while still providing the needed corrections for the exercise. If the client is struggling to perform the exercise correctly or continues to have difficulties with the exercise, then the fitness professional may need to perform the instructional model again and modify the directions where needed. Other strategies that may help in the instruction of the exercise include breaking the exercise down into its different components and focusing on the cues that require attention, modifying or finding another way to explain teaching cues, or practice the exercise movement without resistance and then progress to using the equipment. An example might be practicing the movement of the bench press while standing up, then progressing to laying down, and then finally progressing to adding the bar and the weight. In some cases, exercise cues might need to be worded differently, which may be easier for the client to understand. During the exercise instruction process, clients aren't always going to be able to do what you ask. As a fitness professional, it's important to identify the signs and symptoms of when a client is over-challenged or experiencing difficulties. These may include aggression, competitiveness, discourtesy to other clients, discomfort, and embarrassment. If a client is displaying any of these signs, then it's a good indication that you may need to alter the exercise to suit the client's needs. Some possible methods to do this are change the exercise totally, lower the amount of weight, or give the client an easier option. Many factors will determine whether there will be any complications for clients learning the exercises within the exercise program. Some barriers that a client may experience when learning new exercises or a new program can be a lack of self-confidence, limited knowledge of the exercises and equipment, nervousness or anxiety about starting a new program in a new environment, or anxiety about starting in a new social environment. Beginner clients will be more susceptible to these barriers than clients with more experience. Some motivational techniques which can be utilised to both reassure the client and ensure the exercise is learnt and understood may include setting specific short-term goals for each session. Specific goals allow the client to prepare for what they will learn and will avoid any misunderstandings that they're going to be overloaded with information or exercises they're not ready for. Providing the client with positive reinforcement that is relevant, specific, timely, valuable and accurate will allow the client to gain confidence and a sense of self-worth during the session. Monitoring the client's progress through the session with feedback, such as asking the client how the exercise feels, if they think they perform the exercise correctly, or if they're happy with a particular exercise, gives the client a sense of contribution to their progress and will also help them to actively show how much knowledge they are gaining from the session. This is also a great opportunity to introduce the concept of rating of perceived exertion. Evaluating the client's progress by asking open-ended questions allows the opportunity for comprehensive answers, which are helpful when gathering information and feedback. Experienced clients who've used gym equipment before may also be susceptible to some of these barriers. However, the frequency will be generally less than that of beginner clients. These clients generally have the experience and knowledge to complete new exercise programs without instruction from fitness professionals. However, motivational strategies such as positive feedback and reinforcement can still be useful for maintaining current self-confidence and motivational levels. Each client will be different as to their abilities, learning styles, and speed at which they will progress. Just how you as a fitness professional approach each client's particular requirements is entirely up to you. However, it's important to remember every client is different and as such should be approached on a case-by-case basis. Taking a holistic approach to your client's health and fitness needs will ensure a faster and better rate of improvement and success.